when we think about the whole issue of health, we often get drawn into the nature-nurture debate. Have you noticed that? Okay. So in other words, on the one hand, we've got those things that we are given, be it DNA or otherwise, and there are those things that we receive through the relationship. Now, if I reframe that slightly, I could actually change that from nature-nurture into resource-relationship, which gets us back into that one fractal of 3 that we spoke about that appeals to the soul. Do you recognize that? Meaning, how we derive meaning. Well, what we sometimes find at the level of the soul, looking at relationship, looking at resources or rituals, routines, we may be tempted to try and compensate for one of them that we don't have by taking more of the other. Example, if you have a deficient relationship, you may try and comfort yourself with a resource, which we would then call substance abuse. Okay, can you see the dynamic? In other words, you've got this 3-legged stool of the soul and a misappropriation of a resource to make up for a relationship we call substance abuse. Another example is when we start using people, relationships, as a resource, well, that becomes people abuse. And when we start doing behaviors to make up for absent relationships, that's obsessive compulsive disorder. So can you see how there may be, at the level of the soul, an attempt to try and stabilize the system? And we tend to use relationship, resource, and rituals as the constructs. And this is just to show you how this model sometimes helps to frame it. So relationships, resources, rituals give meaning. Now, we spoke about the coffee, but let's change it to healthcare, because in healthcare, we've got the therapeutic relationship, we have got the resource, there's this medication or whatever, but now we introduce the ritual. And the intervention has a ritual component, because you know what? When we refer to the placebo, what we usually mean is what pharmaceutical companies have declared it to be, which is an inert substance used in a randomized controlled trial. But that is a derivative meaning. The original meaning is the application of a remedy of uncertain merit for the sake of pacifying the patient. In other words, it was understood that even though we didn't know why it worked, it did. The ritual had meaning. The ritual brought meaning. Think of advertising campaigns. You've got the relationship, the girl of your dreams, the husband, whatever. You have got the ritual, going to the beach. What you desperately need is the resource, the car. Right? Then you'll have meaning. Okay? So that's how the advertising campaigns appeal to the soul. Now, let me explain that the placebo aspect has actually blinded us to the phenomenon. We tend to dismiss things as a placebo response, but that is inappropriate. Let me show you something here. The pharmaceutical companies, particularly in America, have become the victims of their own success. They advertise, for instance, antidepressants so heavily on television that now the placebo is about as effective as the active drug. It's not that the drug doesn't work. It's that the placebo works just as well. Okay? Because people have faith in it. And that makes things a lot more complex, because you see, the pill may be inert, but taking a pill isn't. I am taking something that is going to help me with my depression. Look, I'm eating it now. I'm swallowing it. I now have it in my system, right? That has very deep meaning. Now, does that mean it's invalid? No, it doesn't. Communion is a tremendously powerful ritual, because we are appropriating the covenantal blessing related to what Jesus did. But without the relationship, the ritual is not going to have meaning, which is why we need to examine ourselves before we do it, so that the relationship and the ritual and the resource actually have meaning. It's the construct. All of the pieces need to be there. The relationships need to be restored. The resource is there, what we eat and drink, and the ritual of what it symbolizes and what we're doing through it all come together and give us meaning. Now, what is amazing is that some of these rituals actually have neurophysiological effects. For instance, if you are rejected, there's a part of the brain that registers pain. That area is pretty much right next to the area where you would experience essentially a lighting up when your feet are touched. So foot washing is the neurophysiological antidote to social rejection. It's symbolic because it's, I humble myself, I'm washing your feet, I'm serving you. It's mechanical, they stink, you're no longer going to be socially rejectable, okay? But the symbolism is deeply meaningful. So I don't want to invalidate rituals. I want to affirm them. And I want to ask you to not become destroyers of a person's placebos unless they are intrinsically harmful, unless they're being exploited. I mean, motion sickness is a good example. Anything works if you have faith in it, right? So why destroy it in that case? So be mindful, be thoughtful about the placebo response. The color of a pill makes a difference. Everywhere in the world, a blue pill is a sedative. I kid you not. You give a placebo, a blue pill sedative, except in Italy. Why? Because in Italy they have the azzurri, the blue jerseys are symbols of excitement. In Italy, I kid you not, in Italy a blue pill is a stimulant. It's true, you can look it up. If you look at the difference between taking antacids in Germany and Brazil, in Germany a placebo is more powerful than the active proton pump inhibitor in Brazil. Why? Because in Germany, it's not what the doctor is saying, it's not that. It's because in Germany, health preservation by taking medication is a social value. In Brazil, it's an irritation. So again, that second layer influences it. Why can I say that the placebo response is a misnomer? Because of this study, amongst others. This is a headache study in which people took 4 potential things and needed to report the response in 2 hours. A sugar pill with no writing on it, a sugar pill with writing on it, an active pill with no writing on it, and an active pill with writing on it. Guess which one was the best? The active one that had Bayer's aspirin, right? Now, Bayer's aspirin, marked Bayer's aspirin, was not a placebo in the traditional sense because it was an active ingredient. But the branding had an effect. So what is that, the branding response? So placebo is not only about giving a person a false remedy, it's about a deeply symbolic action as well. Now in faith healing, there will be a placebo response, and by that I'm not denigrating the value of it. In other words, the symbol of reconciliation. Jesus touching the leper was a powerful placebo that showed acceptance. Superimposed on that was the supernatural, of course. But do not denigrate, do not disregard, do not play down the value of a therapeutic ritual. And I think that's where the East trumps the West in its health practices, because you are full of health rituals. We are too, of course, but ours look different. And I'm talking generically now, East versus Western medicine. White coat, stethoscope, clean halls, stern look, or in the Middle Ages, top hat for authority, a paunch for dignity, and piles for a worried expression. Okay. So there are certain symbols of confidence that are part of the healing encounter. And using them wisely, in love, affirming of relationship, is appropriate. In fact, God does that too. Okay? So, I just want to leave you with that nugget. And now we're going to switch over to the integrity one. Because here we've got a lot of ground to cover. And it's probably one of the more important areas specifically for the health profession.